Hi everyone, welcome back to my channel. Nurse Katherine here. In today's video, we will be discussing nursing interventions and nursing care for the patient with a musculoskeletal trauma or injury. But before I get into this video, do not forget to subscribe to my channel right now and give this video a big thumbs up. But other than that, let's get this video started. For the past 5 weeks, all we have been discussing is musculoskeletal traumas and injuries. If you have missed any of those videos, make sure you do go back and tune into those videos because that will help you understand today's content. Last week, we also talked about assessment findings in your patient with a musculoskeletal injury or trauma. That is very important in today's content. So if you did miss that video, make sure you do go back and look at that in order to understand, again, today's content. Okay, so you get the call, you have a trauma patient coming in to the emergency room. What will you do first? The first thing you will do is your primary survey. This is the definition of a primary survey. So musculoskeletal injuries can have a dramatic presentation and therefore represent a significant distraction to the trauma team and the patient. So it is imperative that the systematic assessment approach proceeds as usual for every trauma patient, regardless of readily apparent injuries. After your primary survey, you then will go to your secondary survey. This is what a secondary survey consists of. First, you have the history. Then you have the head-to-toe assessment, which includes the head, the chest, and the extremities. Remember those assessments that we talked about in last week's video? That's what you will also be looking for in this type of survey. So after all of your assessments are done, now is time for the interventions, which includes one, splinting, and the second one I want to touch on is stop the bleed. So splinting is normally done during the secondary survey or after the secondary survey. Here's a list of abnormalities that may require splinting for your patient: pain, deformity, bony crepitus, edema, and circulatory compromise. There are so many different types of splints, but we will not be going into that into today's video. Let's get into interventions for more specific injuries. First, let's start with an open fracture. With an open fracture, you are going to remove any contaminants around the area. You are going to cover the opened wound with sterile saline-soaked dressings. You are then going to administer antibiotics as ordered, of course, and then administer tetanus prophylactically according to the CDC guidelines. Amputations and penetrating injuries are totally different, so let's get into that a little bit. So interventions for an amputation or a penetrating injury include the following. First, you will apply direct pressure to that site. Then you are going to elevate that extremity and place a tourniquet if the pressure and elevation fail to control the bleeding. Those are your first interventions when coming across an injury like that. With that being said, I do want to talk about stop the bleed. Stopping the bleed is so crucial because you can save your patient this way by stopping the bleed. This picture shows what stopping the bleed means. It's also been said that massive bleeding can result from many types of injuries, and victims can die within 5 to 10 minutes if nothing is done. In order to prevent deaths associated with bleeding, it is important to learn proper bleeding control techniques and quickly stop blood loss. This, again, was not an exhaustive list of every intervention that you will be doing as a bedside nurse when you have a patient with a musculoskeletal injury or trauma, but this is just a start. If you're interested in traumas and this type of nursing, ask your educator or look into taking the TNCC course. That is what I took when I became an ER nurse, and that taught me so much about this type of information. But other than that, that is it for today's video. Thank you for tuning in today and hanging around with me for the last 5 weeks for our 5-week series on musculoskeletal injuries and traumas. I'm excited to get a new series started next week, so make sure you do hit that notification bell so you know when a new video is being posted. Have a great week, everyone, and I'll see you in Saturday's video.